Today, black fungus is being discussed everywhere. Following COVID, people have reached a new level of terror. As a result, everyone should have a better understanding of black fungus. Hello, and welcome to a new episode of Billion Stories. What is black fungus, also known as mucormycosis? What are the signs and symptoms? What are the underlying causes of this disease? Who is at risk of contracting this disease? Is there a treatment for this disease? In this video, we will answer all of your questions about black fungus. So, let's get started. Mucormycosis, also known as black fungus, is a fungal infection. This is not a disease that appeared yesterday or today. This is not a contagious disease that can be passed from person to person. Furthermore, the disease is extremely uncommon. While COVID affects millions of people, only a small percentage of them develop the disease. Aside from that, there is no need to misunderstand or be concerned that everyone infected with COVID will develop black fungus. However, it is critical to recognize the first signs of black fungus. In any case, if those symptoms are present in COVID patients, they can seek immediate medical attention and be free of the disease without further complications. As previously stated, this disease did not appear overnight. For a long time, the disease was rarely reported in many people. It is more common in people with uncontrolled diabetes, leukemia, people who take immunosuppressive drugs after transplant surgery, cancer patients, people with weakened immune systems, and people with HIV. For many people, the name black fungus is a misnomer. The production of a black, melanin-like substance does not cause the disease. The name black fungus derives from the fact that the fungus enters blood vessels in affected areas and blocks blood circulation, causing the area to darken. Gangrene is the medical term for this condition. The most important aspect of this disease is that everyone should be aware of and understand its symptoms. First and foremost, everyone must understand who is at risk for this disease. This is due to the fact that everyone is less likely to contract the disease. Who is afflicted with black fungus? People who seek treatment primarily for COVID, as well as those who take high doses of steroids for an extended period of time and do not control their blood sugar levels during COVID treatment, are more likely to develop black fungus. People with COVID have a weakened immune system, which causes these diseases to become more severe in the body. The body will eliminate fungal infections in those who are immune. What are the signs and symptoms of black fungus? Swelling inside the eye, redness of the eyes and inability to open the eye, swelling or thickening on only one side of the face, complete nasal congestion, dry nose, bleeding, and pain in the eye are all symptoms of black fungus or mucormycosis affecting the eye or sinus area. There is no need to be concerned about other mucormycosis symptoms affecting the rest of the body, because it is extremely rare. It can, however, affect the kidneys, digestive system, skin, and lungs, and is more common in critically ill ICU patients. None of these are observed in patients following COVID-19. Many people were alarmed when news broke that a black fungus case had been confirmed and that the eye of a patient infected with black fungus in Kerala had been completely removed as a result of it. Many people have begun to ask various health professionals on social media about their minor headaches, dark circles around the eyes, and slight redness of the eyes, which are all symptoms of black fungus. However, none of these are symptoms of black fungus. When you notice a significant swelling of the eyes, swelling on one side of the face, and blood oozing from the nose, it is critical to suspect black fungus and seek treatment as soon as possible. Again, taking care of the disease is more important than treating it. What is the best way to combat black fungus? First and foremost, anyone seeking COVID-19 treatment in the current situation should check their blood sugar levels and strictly control them with the assistance of a doctor if they are taking steroid medication. In no case should the blood sugar level be too high. Second, the reason for the high number of black fungus cases in India is that they use oxygen in an unsanitary manner. This means that if a COVID patient or any other patient is required to inject more than 3 liters of oxygen through the nose, the mucous membrane may be damaged, resulting in infection. The use of contaminated water in oxygen bottles is to blame for the high number of black fungus cases. The old method of watering inside the humidifier should be abandoned to get rid of black fungus infestation. Finally, if the mask is not used properly, black fungus can appear. This is due to the fact that the black fungus has been found in people who do not have diabetes. Using a mask for more than 1 day without washing it off can also cause black fungus. Using the same mask for several hours can cause moisture particles to accumulate and the presence of fungus to form, which can increase over the course of a day, causing the person wearing the mask to catch black fungus. As a result, avoid wearing any masks for the entire day. To avoid the presence of fungus in the mask, use one mask from morning to noon and another mask in the afternoon. We can greatly reduce the risk of developing black fungus by doing so alone. Is there a treatment for black fungus? When the black fungus is first discovered, surgery is performed on the affected area. The main treatment for black fungus is to completely remove the infected parts and use antifungal drugs. It may take months for powerful antifungal injections and medications to remove the fungus from the blood. The major challenge is that the victims have a high mortality rate and the drugs are expensive. I hope you enjoyed this video, and please share this very informative video with your friends. Don't forget to subscribe to this channel and click the bell button to receive notifications when we release new videos. Thank you for watching and subscribing.